Hello again. With a new subvariant of Omicron identified in South Africa, many people are wondering if the country will find itself in another lockdown with an increase in new COVID-19 cases. However, experts are saying there is no cause for concern as yet, but people should practice caution. The Health Minister, Dr. Joe Phaahla, and his Deputy, Dr. Sibongiseni Dhlomo, have given an update on the situation that was earlier today. Listening to them is my colleague, our senior reporter, Silindelo Masikane, who's joining us now live from our studios in Cape Town. Good afternoon, Silindelo. Thanks for your time here on Today. So what more do we know this afternoon about this subvariant and the specimen that was detected that had this subvariant?
So you would remember, Bradan, that we got information with regards to the subvariant that's been wreaking havoc really in countries like China as well as the United States, that a specimen that was received at the Stellenbosch University at the lab had picked up this Omicron subvariant. At that point, we still had very little information in terms of where it came from. There was speculation that it came from the Western Cape because the lab that had received it is in Stellenbosch. But however, during this briefing from the health minister, we know that it was a random sample. We don't know whether the person who had tested for the subvariant is based here or from somewhere else in the country because of the fact that it was a random sample. But at this point, what we do know is that it is the only confirmed case of the subvariant. At this point, more tests need to be done to see whether, in fact, whether the subvariant has actually spread across the country and just how wide it has. But at this point, the official confirmation is that there is only one case of the subvariant that has been detected, and that sample was from somebody who had tested around the December period, and the particular sample comes from the batch that was labeled the 27th of December. So let's just take a listen to what the minister had to say with regards to whether we have any more information about this particular specimen.
Here in our county, on the 7th of January, the Genomic Surveillance Unit at Stellenbosch University, which is a member of the Network for Genomic Surveillance, reported the detection of XBB.1.5 subvariant from a specimen which was obtained from a patient on the 27th of December 2022. So even though the announcement was made on the 7th of January, this specimen had been obtained from a patient on the 27th of December. So because the genomic surveillance is not done at the basic laboratory, whether it be NHLS or private laboratories, so that's why the time lag between the collection and the reportage of this XBB.1.5 subvariant. The specimen was submitted to the genomic surveillance as a random sample. So there are no details of the patient. The emphasis here also is that the patient may not even be from the Western Cape because this was a random sample.
So the big question, I guess, on many people's minds this afternoon, Silindelo, will be how will the country then be handling this situation moving forward?
I think, of course, Bradan, like you said, there was a lot of anxiety whether we'd see the return of lockdown restrictions. But speaking to, of course, health professionals, they've reiterated the fact that South Africa has reached population or herd immunity. However, before the briefing, we know that the minister met with the National Coronavirus Command Council as well as the World Health Organization to get a sense as to how perhaps South Africa should be proceeding moving forward. And it does seem as though the advice right now is, of course, not to panic, but to increase surveillance, testing, and of course to once more revive the campaign for South Africans to vaccinate. Let's take a listen.
We have consulted our ministerial advisory committees and also WHO, the World Health Organization in Geneva, and also the regional office in Brazzaville. And in both cases, the advice that we have received is that there is no need to impose any travel restrictions. on any country, including the People's Republic of China, and that we also do not need to reimpose any restrictions internally in our own country.
Health Minister there, Dr. Joe Phaahla, clarifying the approach the government is taking in relation to the discovery of the new Omicron subvariant in our country recently.